Hi everyone, today is the day after Lucky's surgery. I haven't had much sleep because I was up all night trying to give her water and trying to keep her up. The surgery went well, but she had trouble waking up from the anesthesia. She was shivering, and so bringing her home, I was hoping to make a video when I was gonna bring her out from the vet, but because her situation was not good, so I had to pick her up and I had to carry her to the car, and luckily my mom was there too, so we both together brought her home. And I didn't want to focus on filming any of that because it was just a lot to handle and just traumatic for us. So yeah, she's home, and I wanted to make sure before I film her again that she would at least be alert or has had water or a little bit of food in her system. So this is Lucky. I'm gonna show you to her. So I'm being very quiet because Lucky is finally getting some sleep. This is how she's doing right now. She's had the mask has been removed because she's sleeping. So you can see the sutures, it's been sewn up. She also had another surgery done on her underbelly. I will go in details about that in a video, but I just wanted to show people, those who have been asking, that Lucky is out of the surgery and she's now focusing on her recovery. She's not 100% yet, but she is better than yesterday when we took her out of the vet, and hopefully she will regain more conscious and be back again. But I will make a video and I'll tell you what exactly happened with Lucky's surgery yesterday. Let's let her rest and I'll talk to you. Hi everyone, good morning. It is I think around 7:30 here in the morning. Lucky's sleeping and I finally get to have my first cup of tea for today. I am talking very softly because Lucky is resting, and I hope you can hear me. I'm going to try to put in Sinhalese translations in words for those who are following in Sinhala. Thank you. This video is going to be in English because I want to make a rotation of videos in my channel with a mix of Sinhala and English. So since I've been making a lot of videos in Sinhalese, I thought it'll be fair to my viewers, supporters who speak in English only to follow and get an update on my life with Lucky as well. Okay, so yesterday, the day of Lucky's surgery, was, to be honest, was quite stressful. Even though I had been through surgeries with Lucky before, one surgery in particular, and I myself have been through surgeries. Seeing someone you love, a pet, go through and sending them over to the vet, even though you know it's the right thing to do, it's not easy because first of all, it was because Lucky does not know what is happening to her, even though she's in pain and she has a mass that needs to be removed and other issues. There's no way of communicating directly with her and letting her know that she's gonna go through a procedure and it's gonna hurt her and she's gonna come out feeling better, because they're animals. And but I'm hoping deep down she knows that this is for her best. Excuse me. I have been carrying her a lot for the past 24 hours, but especially after the surgery. So I was gonna film her coming out of the surgery. Her surgery, I got a call after her surgery saying that everything went well, that she is ready to be picked up, that she was up and she was alert. But unfortunately, when I got there, the nurse told me that she went back to sleep and she wouldn't get up, and asked me to wait for a while till they can prep her to come out again. So I waited for a while, about 15 minutes, and they couldn't get her up. So finally the nurse carried her and brought her out, and Lucky was actually shaking, and she was just pretty much, I think, knocked out. And I was told that was because of the anesthesia, but I have seen Lucky come out of her previous surgery just walking out, but maybe because she's much older now and her body has taken quite a heavy toll yesterday with the surgery, she wasn't as active as her last surgery. So that was concerning. So I was worried, and I asked them, what should I do if something were to go wrong when I take her home? And then they're like, you can go to the ER, and but she's gonna be okay, just monitor her. So I believe them. They're a good vet. We've been going there for a while now. So they healed her last year when her mass actually ruptured, and so they just said, this is the anesthesia, so just hang out and see how she responds within the next day. So anyway, just like that, overnight she started shaking her head, and then she regained some conscious. I was able to give her a little bit of water. They told me to leave her water on a minimum because she might choke from regaining conscious after anesthesia. So there's a lot of precautions that you must take when you are dealing with a pet coming out of surgery, and I'm trying to do that to the best of what I can, while also knowing I'm fortunate I've been through a surgery with her before, but this one is actually quite different than what I expected from last time. Last time she got her mass removed from 5 different sites, and it was pretty invasive, but she came out, and then her recovery one site had some complications, but apart from that, she recovered in about few weeks and she was good. But this time her mass came out you might have seen my previous video and the picture, it was really big in comparison to size last time. So they got the growth removed, which was good. That was the first thing they did. But the doctor called me and told me that her teeth, which I knew was pretty bad from the beginning, so they had advised to get all her teeth removed, but I wanted to keep as much teeth that she could, because I would like her to have some sensation of biting and chewing food, or at least having teeth, because I think it's important for her, and just to feel like she has that ability, because she's able to chew food, but not as much as she did before. So I took the doctor's advice, and then they were able to agree to remove the really bad ones, and then they ended up removing 6 of her teeth, which is quite a lot, but this is, so she had her mass removed, she had a total of 6 teeth removed. You can see from the diagram, the ones with the O are the ones that are missing, so she never had those teeth to begin with, and the ones with the X are the ones that were removed yesterday, and the ones with the empty boxes are the teeth that she has left. So she still has a good amount of teeth left for her age, so I'm happy for that. Hopefully she recovers and feels better soon. So back to the video. When I got lucky, she was actually rescued from the previous building that I lived in. She had no rightful owner. Someone had just left her in that building. So from the landlord, I learned that she was about 10 years old back then. So now I have known her for about 6 years. I have been taking care of her in my space for about 4. When I previously lived in my old apartment, she lived in the hallway, so I made her a house and got her her necessities and took care of her there, and a heater and a space heater and everything for the winter. But as we had to move out of that building, we as in me and the other tenants, but because it was getting demolished, and Lucky, no one would take Lucky, and I, of course, like, give Lucky to me. I will officially take Lucky in. Wherever I go, I will be her owner, and I took her in from that day, and that has been about 4 years, going on, about 4 or 5 years now. So we've pretty much, since then is when I actually took her in and took her to the vet, got her vaccines, got her shots, her checkups, and got her mass removed, which was over a year ago. But when I first got her, the doctor, one of the first vet that I took her into, told me that she only has 6 months to live because her condition was that bad. Imagine a dog being neglected in a building for 10 years. I have her pictures from the past. She was really matted, matted as in her hair was not managed, and when I even before taking her in, and when I first saw her, I gave her a bath. I could like feel like her skin and her body just was not good. That's when I was like, I need to, even though at that point I lived in a studio in a small space, I did not have the space to keep her in my own room. So, but I built her room, and I made sure that was the beginning of me getting to know Lucky, because I never had a dog before. So I provided her with the water, with the heat, with the food, because she did not have food. Pretty much, she was eating nibbles of biscuits, whatever the other apartment folks would give her, and they were even expired. And pretty much, she was at the mercy of whoever lived in that apartment building, and to give her water or anything. So when I looked at her water, even it was not clear. It had green, I don't know, growth, probably mold. I don't know. It was just horrible. That's all I can say. And even though I didn't want a dog, I'm like, even if I don't have the space for a dog, I'm going to make sure that this dog lives. Because at that point, it was uncertain in the beginning who owned Lucky, because I was trying to trace like there just can't be just Lucky left in the building. But the landlord assured me no, somebody had lived in my previous space before and kind of left her after. Anyway, so that was her past, and so she's had a traumatic past, and I just happened to be someone who met her in that journey, and I decided I'm gonna take her in after, especially after the space that she lived in was getting torn down. So I moved into a 1-bedroom with her right after that, and it was great. We have memories of that. And then she went to the vet. The first vet told me, of course, that she's only gonna live 6 months with her mass. And the second, and then I refused to believe that, because I'm that person, because it's like, because Lucky, even though she had all these mass like growth on her body, and she did not look groomed, or she did not look super I don't know, like she was, I knew she was healthy for some reason. I just knew, because she was full of energy. We would go for walks. This was back then, and then I knew that she wanted to live. That's the one thing I knew about Lucky. Even before I checked on her mass or her growth, I just knew Lucky was a dog that wanted to live, but never had the opportunity to live because of the living conditions, because of the box that she pretty much lived in a box. So I was like, if this dog had spent 10 years in a hallway in a box, and every time I take her outside, she just wants to be outside and just wants to be seeing other dogs and people, and she's very friendly, depending on, how dogs treat her. She can also be aggressive if they are mean to her, but she's, for the most part, a very sweet dog, and an intelligent one too. So I was like, there's no way she's only gonna live 6 months after I find her. So I went and I researched, and I found another veterinarian which is the veterinarian that did her surgery last year and also this year. And I did not say anything, but the vet was like, oh, we can do this surgery. We're going to remove all of it and she's going to go home okay. And I liked that response. And it's like, yay. I didn't even talk about, mention the previous vet, because I'm like, see, all it takes is for someone to believe and try. So even with vets, I don't know, they're just like people, I guess. Some have different experiences. Some might perceive a dog differently based on their age and their history. Some vets probably have more expertise with certain dogs and seeing them. So this vet was a blessing. Even though the other one said she'd live 6 months, this was later. So she gave me pain meds, the previous vet. So that was able to manage her pain, but she lived more than 6 months. She lived, 4 years, 5? Yeah. And then last year with the other vet, when her mass ruptured, this vet, it's like, we'll do the surgery immediately. And then she came out, she recovered 2 weeks, and then about 3 weeks or so, she was back and she was really good. So this time around, her mass came back, and the doctor said it's probably because I did not know if she was spayed or not, because there was no history on Lucky. I was told by the previous landlord that, you know, someone had taken care of her. So I just assumed that if someone had at one point taken care of her in the past, that she might have been spayed, because that is the pretty much norm here. But I guessed it wrong, because she was actually not spayed, with her growth coming back, and the doctor said that this might lead to plyometra. I don't know the word. I'm gonna try to type it out. Pretty much it's like a complication that happens with female dogs' wombs if they're older, so it's better to get them removed while they're under anesthesia and going through a procedure. So he's like, if you're gonna go with the mass removal, I recommend also getting her spayed, because it seems like she's not been spayed. So I know it's a lot, but to reduce the chance of her getting the mass again, I personally decided that she will get spayed and she will also get her mass removed. That way it minimizes her of getting plyometra. I don't know what, I'm gonna look it up. I'm gonna put the exact word so that you know, if anyone's watching this and has a dog that's getting older, how spaying can help them in their older age. So yesterday, I went in pretty much thinking it's gonna be just her mass removal, but for her better future and better healing, she got her teeth removed, 6 of them. So where are they? So they actually put the teeth in, wait. Okay, so there's like 6 of them here. Yeah, 6 teeth, patient's teeth. Wait, how do I? Okay, so, and then she has an incision on her belly, and then she has an incision, of course, on her back. So she's quite, she's going through, what do you call it? Recovery right now. Yeah, so I have to soft feed her according to the instructions, which I have done in the past, so that is not going to be an issue. But I hate to leave her collar on, but I have to leave it on because otherwise what she's going to do is she's going to try to pull her incisions, the stitches on her incisions, and that's not going to be good. And she starts medication today. She hates medications when it comes to like pills. She just puts it in her mouth and spits it out. But I asked my mom to hold her for a bit, and then I pretty much you gotta take it. And that was after some food. Of course, she's not eating, so what we do is, even previously when she was healing, this was when she had a little more teeth and it was in a better state. We would powder this. I would pretty much, this is her biscuits, so powder this in a blender to particles, and then mix it up with water, and I would make soft little, almost like gummy bear small balls, and that would be easy for her to digest, because Lucky does not like canned food. The smell of it is just so pungent for her. I feed her natural, whatever I eat, fresh chicken with carrots or rice, that's one of her favorites. Or if I'm making beef with curry, it'll be very subtle for her. I make sure I put the ingredients that only her palates are good, that she likes. But right now she can't eat any of that heavy dense food, so she does like this biscuits. That's been her go-to everyday biscuits. So I had that powdered up already, so I mixed it with water, and then since she took in some water after midnight, I'm like, okay, now it's a good time to give her some biscuit water, or powdered biscuit, it's almost like a soupy consistency. And she was hungry, so she ate 2-3 teaspoons or tablespoons of that, maybe 3. So I was very happy. So she had some food, something in her system now. So this morning, about a couple hours ago, gave her pain meds and then her antibiotics. So that's it. So now what I gotta do is monitor her, and to keep her movement to the minimum. That's what the instructions say, because we don't want her running, walking. She can walk, but right now minimum walking for at least 24 hours, and then definitely says no running, jumping, climbing for 14 days. That's her. Okay, I'm gonna go check on her.